So once again, we're continuing to look at the methods from Charles Hazzard. So remember to pause and read the descriptions. We have two descriptions, one for soft tissue of the neck and one essentially for adjusting specifically the atlas, but these methods can be continued further down the neck. So the first method, he's talking about standing on one side, using the palm, so palm down on the opposite side to grab the tissues, right? And then the other hand on the forehead of the patient. So he's talking about working on the soft tissue on that side. So essentially what I do is I don't just go and straight grab it, right? What I do, bring his head over, expose, heel of my hand, right? So I'm working on the lateral tissues over here. So the heel of my hand will contact that. So I can go all the way around, depending on the circumstance, and get my finger pads to the spinous processes. Now, he doesn't talk specifically about this, but he's talking about this side of the neck. So the way to figure out that you're on in this case, the left side of the neck, is to get to the spinous processes and then come to that side of the spinous processes. So you have all the lateral and posterior tissue of the left side, or of the side you're working on. So I work here, spinous processes, note them, and then come lateral to them. So basically, now what I do is I just cut my hand like this. It's almost like the sound of one hand clapping, because anything that's in that will come away from the midline and I'll have good contact with it. So here, spinous process, come to my side, close them together, so the sound of one hand clapping. He does talk about working nice and gently and smoothly here and being slow. So I can short lever this tissue, so I can keep the head still and short lever this tissue. So a nice straight arm, I just kind of go up and down. But what I can also do is move the head in relation to the still muscle. So I hold the muscle still and move the bone under it. I hold the bone still, so the head stays still, and I move the muscles, so the moving muscles, still bones, moving bones, still muscle, or I can do some combination of both, right? So that's the method with respect to the soft tissue. With respect to the atlas, he talks about standing at the head of the table, head between the hands, thumb and forefinger on the lateral process of the atlas, or of the atlas. Says basically what you're going to try to find, you're going to diagnose, you're going to find which side it likes to go to. Once you find your diagnosis, he talks about exaggerating the lesion. Now, exaggerating the lesion means take it the way it likes to go. So that basically means go in the direction of preference first. You wouldn't quite classify this indirect because it's based on motion preference. It's not based on soft tissue response. Going indirect means making the soft tissue soft. Exaggerating the lesion means going the way it likes to go. So he's talking basically like this, right? You go here, say he likes to go this way. He says, go that way, create traction to further exaggerate the lesion, and then you basically turn it and then use force. So you're going to overpressure. Now you see, as you may not see it on this side, but you may see it as I come towards this side. When my hands are cupping the head, what I can do is as I turn, watch my wrist. I can roll his head onto my forearm, so now I have more control over him. So I lose a little bit of freedom of motion, but I've got good control. So essentially exaggerating the lesion, take it the way it likes to go, create traction, so I just hold on to him. I don't let my body move away from my hands. I move everything as a unit. So wherever my hands are in relation to my body, they stay there. I lean, that's my exaggeration, and then I can take them the other way. Right, so that's one method he talks about. The other method is he's talking about standing on the side. Right, so I just turn him, I can stand on this side. He doesn't say necessarily which side to stand on, but I can short lever here, right? Because he's supported on the pillow. I can short lever here as overpressure to take him the way that he wants to go, or I can use the hand on his head. So I've got relative long lever, relative short lever for mixed leverage. And then here, if I'm standing, I can work on that motion. I can create traction here to some degree as well. Right, so if I move away from my body, I won't create any traction. If I set my hands and I keep my hands in the same place with respect to my body, I can create some traction and then create that overpressure as may be needed. So those are the methods from Charles Hazzard with respect to the neck.